Okay, so before I administer any medication to my patient, I'm going to check them on and verify that the medications that I pulled are all correct. So before I go in, I'm looking over the patient's chart, looking for any contraindications, risks for aspiration, anything that I should know about allergies, and that sort of thing. So I'm going to go into the patient's room. Hi, I'm Tiara. I'm going to be your nurse today.
Hi.
How are you?
I'm good. How are you?
Good. And I'm checking the MAR as I'm speaking with them. Can I get your name and date of birth?
Erin Jansen, 092694.
Okay, thank you. Now, do you have any allergies?
Not that I know of, no.
No? Okay. Now, we're going to administer some medications today, and I'm verifying that I have my right medications, I have the right patient, I have my right medications, I have the right dosages because I've looked for any risk for aspiration, I have the right routes, and it is the right time. And I'm going to document once the patient has taken the medication. Okay, so I'm going to go perform hand hygiene. I'm going to put on gloves. Okay, Miss Erin, first we're going to give you your inhaler. This should help open up your airways and help with your cough so you can breathe a little bit better, okay? Now, have you ever used one of these before?
Yes.
Okay, so you know to shake it for 2 to 5 seconds first. You're going to place it to your mouth. Inhale and hold for 2 seconds and repeat. And I'm watching as the patient does this to make sure they do it correctly. If she is inhaling too fast, we would use a chamber to make sure that the medication is being administered at a good rate. Okay. And next we're going to use your guanipacin, and this is for your cough, okay? And I will mention that with the inhaler you may experience some tremors, a little bit of shakiness, restlessness, but as time goes by, that should wear down, okay? Next we've got your cough medicine. This should help thin your mucus, okay? It may cause nausea or dizziness, but those aren't really common side effects, okay? Just so that you know. When I pour this, I'm going to get at eye level. I'm going to pour the correct amount. If I pour too much, I will not pour it back into the container. I will give the patient the option of administering it themselves. And next, we're going to give you your nicotine buccal pill. It's going to go between your cheek and your gums. This is for your nicotine withdrawal because we know that you are trying to quit. You may experience some impaired concentration, dizziness, or nervousness, but this is supposed to help with that. Okay, if you place this in between. No, do not chew this. Let it dissolve in your cheek. Try not to swallow for a little bit. Let that dissolve, and that should help, okay?
Okay.
Next, we have your furosemide. This is a diuretic, so it's going to increase your urine output. Okay, you may experience, frick! I don't want to say in the video.
Why?
Should I say Drink?
Dehydration.
Dehydration does. Okay, did you push stop?
No.
Okay, we're going to keep going, Haley. Alright. So, with the furosemide, this is going to increase your urine output. I'm crushing the furosemide and I'm placing it in the applesauce, a small amount of applesauce so that they eat it all, and I make sure that she likes applesauce before I gave it to her. Okay, does that taste fine?
Mm-hmm.
Okay. You may also experience constipation with that as well. Okay, and after using the pill crusher, I'm going to wash it and make sure it's dry for the next person who uses it. Okay, now if I could get you to lay on your side, please. We're going to administer, you can lay on your left side. We're going to administer your eardrops. It should help break up that earwax. You may experience some lightheadedness or some dizziness. Now, the patient is going to lay on their side, and I'm going to administer the drops. If you could lay right there for a couple of minutes. Okay, now if you could lay on your back, we're going to get...
Tiara.
What? What's wrong? I didn't know we had to do that. Okay, now if you can lay on your back, we're going to give you your eye drops for your glaucoma, your Timolol eye drops. And you may experience some dizziness with these as well. This is for your glaucoma. And then we're going to give you your eye ointment, and that's going to help with your pink eye. And we're going to administer that in your lower lid, okay? And the side effects are similar: dizziness, lightheadedness. You may experience a brief stinging when I place these in your eye, okay? Okay, now with my non-dominant hand, I'm going to hold the lower lid, and I'm going to drop them into the lower eyelid sac. Okay, now if you could lay there, and we're going to add your ointment. After placing the drops, if I don't want the drops to become systemic, I can hold the lacrimal duct in the middle for a few seconds. Now this is your eye ointment for your pink eye, okay? And I'm going to administer a line of the ointment in the lower lid. Okay, now lay there. Now close your eye and move your eyeball around. Look around the room with your eye closed. Okay, you can sit back up. Now what I'm going to administer now is going to be for your angina, that chest pain that you've been experiencing. This is called a nitroglycerin paste. And so I'm going to prepare that paste on one of these, checking the mark to verify how much I need to apply. Getting my gauze pad ready. Now, if I could have you sit up on the end of the bed and put your feet facing me. And I'm going to raise the bed. Like this? Yes. So I'm going to apply this to the chest. And then I would, after that, cover with this gauze pad. Okay? And you may experience a little bit of a tingling sensation at first. This is supposed to help with that pain. So if you feel any dizziness, any nausea, or anything like that, please let me know. And we're going to have you rest and lay down with that. We're going to be sure not to place it over anything. We don't want to place it over the nipple. We don't want to place it over irritated skin either. Okay, and after I'm done administering these medications, I will dispose of them how I should. And I'm always checking and doing my documentation. I will then come back and evaluate for any side effects. Hello, have you experienced any side effects since I've administered any of those medications?
Just a little bit of dizziness.
Okay, anything else?
No, I'm good.
Okay,
Thank you.
I'll be sure to document that where I'm supposed to, following all the regulations. And that is